Okay, so we're going to talk about the ACE inhibitor, also known as a angiotensin converting enzyme inhibitor. In this module, we're going to cover these drugs, but before we cover these drugs, we highly recommend you watch our video. It's our AA system on renin angiotensin aldosterone system, because if you understand that one, you'll understand these drugs better. So let's talk about the indication first. These medications are used for high blood pressure. So if someone has a high blood pressure, these medications are used to control the high blood pressure. And also these medications are also used for the control of the diabetes symptoms related to the kidneys. So symptoms related to kidneys. And it also used in the heart failure as well. Now in the next slide, we'll go over the mechanism of action, and we'll see why do we use this medication for these disease processes. Okay, so this images is basically showing the RAA system, and if you have looked at the video about the RAA system, you know the angiotensin converting enzymes right here converts angiotensin 1 into angiotensin 2, and the angiotensin 2 has a wide variety of effects in our body, including it increases the sympathetic system, it increases the vasoconstriction, and increases the blood pressure. It also increases the sodium reabsorption and also the water, while it increases the potassium excretion and so forth. So when we block these ACE enzyme, nothing's gonna convert from here. The angiotensin 1's not gonna able to convert into the angiotensin 2. So we are breaking this chain from right here, and that means there's no sympathetic activity, no sodium and water reabsorption is gonna happen, and no vasoconstriction. So let's see what's gonna happen now when we block the ACE enzyme. Let's go to the next slide and take a look. So this is a kind of simplified version of that AA system. So when we block this enzyme right here, well, decrease in sodium reabsorption, decreasing water reabsorption, now this is gonna decrease in blood volume and fluid overload. And that is the reason why we use these drugs for heart failure. Now, at the same time, when the sodium reabsorption and water reabsorption is gonna decrease, it's gonna increase the potassium reabsorption. And the potassium level is gonna increase. Okay, just remember this one from the previous slide, that in the normal RA system the potassium level goes down, but when we block this angiotensin converting enzyme, the potassium reabsorption is gonna go up and the potassium level is gonna go up. This will help you to remember one of the side effects that we will go over in the next slide. Now when we block this enzyme, the angiotensin won't be produced, and it's not going to work on sympathetic nervous system as well, and it's not going to cause the vasoconstriction. So what it's going to do, it's going to decrease the vasoconstriction. When it decreases the vasoconstriction, the blood pressure is going to decrease, and when the blood pressure is decreased, heart will be able to pump blood more easily. So heart able to pump blood more easily, because it won't have that resistance to come the heart won't have that resistance to come over when the blood pressure is high, because it's not going to do vasoconstriction anymore. And that is the reason it's also we use the medication to decrease the blood pressure and also for the heart failure, because it's gonna decrease the heart workload. All right, so that's how basically the mechanism of action of the ACE inhibitors. Let's look into the next slide, what are the side effects, contraindication, and the nursing consideration to remember. The very first one is severe hypotension after the first dose. So many patients can have a severe hypotension after the first dose, and the hypotension symptoms would be, you have to look for as a nurse, is the dizziness, lightheadedness, and faintness upon rising. So you have to instruct the patient after the first dose, do not get up suddenly, because it can decrease their blood pressure significantly and they can feel dizzy and can fall. As a nurse, you want to assess the blood pressure before giving the first dose, and then after periodically to make sure their blood pressure is not falling down significantly. Okay. Now, as we talked into the previous slide, let's go back to the previous slide really quickly. That it increases the potassium reabsorption. When you block the angiotensin converting enzyme, it's going to increase the potassium reabsorption, going to increase the potassium level. And that is the reason one of the side effects of this medication is high potassium level. So what are the symptoms of the high potassium? Could have been confusion, numbness, or tingling in hands and feet. Can cause the cardiac arrhythmia. And also, since it can cause the high potassium level, it is contraindicated into the potassium sparing diuretic and also the salt substitute. The potassium sparing diuretic pretty much increases the potassium reabsorption as well. So you don't really want to put patient on two different medication which both increases the potassium reabsorption and increases the potassium level. So they're contraindicated in a patient who's taking potassium sparing diuretic. And also the salt substitute, because in the salt substitute they add potassium. So that's gonna, if they're on salt substitute, it's gonna even increase more potassium in the body. So that's why they're contraindicated. One of the main side effects that as a nurse you have to remember, and as for the NCLEX as well, is the dry cough. Remember, like the ACE enzymes is located in the lungs. Now this medication inhibits the ACE enzyme in the lungs, can increase the level of bradykinins in the lungs, which is basically an inflammatory agent. And because of that, accumulates this bradykinin in the lungs, it can cause the dry, persistent cough. So in that case, what you do is either tell the patient to take a cough medication per doctor's instruction, or they usually change medication. If it's really intolerable and really persistent dry cough, they change the medication to the ARBs, which is angiotensin angiotensin 2 receptor blocker, which we're going to cover in a different presentation. Angiotensin 2 receptor blockers. This medication can also change the ability to taste. So the patient can have the salty or metallic taste, and also sometimes decrease ability to taste. And in that case, you really want to tell the doctor and change the medication to something else to control either the blood pressure or the heart failure. Okay. Now, another important side effects to remember is angioedema, which is swelling around the lip, eyes, throat, and other body region. Now, since this can cause the swelling around the throat, it can lead to airway closure. So this is kind of serious side effects. One of the serious side effects of this medication is the angioedema. So you really want to educate the patient about this angioedema, and it can develop after the first dose or in a few weeks. So you really want to tell the patient to monitor of the swellings of this lips, eyes, throat, and if it happens, tell the doctor as soon as possible, like emergently, I would say. Now there's a particular drug in this class, is called captopril. It can cause the neutropenia, which is basically decreasing white blood cells. So you want to monitor the white blood cells before you give the medication and periodically to make sure the patient's not going to have a neutropenia. And since this medication decreases the blood flow to the renal, kidneys, you really want to monitor the BUN and creatinine, which represents kidney function. Now, in which patient these medications are contraindicated? Now, if we go back to the side effects and the mechanism of action, it's kind of self-explanatory, like in which patients this is contraindicated. The first, it definitely decreases the blood flow to the kidneys, so it is contraindication in a patient who has a decreased renal function. Most of the medication is metabolized by the liver. So if a patient has a liver damage, you don't really want to give this medication because it can accumulate in the body to a toxic level. Now, captopril can cause neutropenia. So if a patient has either one of these, bone marrow depression, immunosuppression medication, or if they have any kind of autoimmune disease, you don't really want to give patient this medication because it can even cause more decrease in immune system. And if they have a decrease in immune system, they can have the indication would be like a sore throat and all the other infections. So you want to educate the patient about that too. Now, how do you find these ACE inhibitors? It's a really easy way. You can call these drugs pril drugs. If you look at the name of this medication, at the very end of all drugs, it ends with prils. So any drug that ends with prils, it's ACE inhibitors. Quite easy. Alright, so if you have any questions about this medication or any mechanism of action or side effects, you can email us or contact us. Thanks for watching.